Welcome to the Spark Live webinar series, one component of our Spark Knowledge Mobilization Program. Spark is Children's Healthcare Canada's shared platform for advocacy, research, and knowledge. Spark Live is where we gather each week to curate, convene, and showcase excellence and innovation from across the child and youth healthcare community. Our goal is to spark conversation, ideas, and action. Children's Healthcare Canada would like to thank our funding partners for their ongoing contributions that support all of our programs and activities, including this Spark Live bi-weekly webinar series. There are two options to join in on the live conversation. Questions and comments for our panel or presenters can be typed into the question box, or comments that you want to share with the audience can be typed into the chat box visible to all of our attendees. For those of you on Twitter, tag @ChildHealthCan on any webinar-related tweets or use the hashtag SparkLive. And to keep up to date on all of Children's Healthcare Canada's webinars and other activities, be sure to sign up for our weekly Spark News e-bulletin by visiting our website at childhealthcan.ca. Hello everyone, and welcome to another edition of Children's Healthcare Canada's Spark Live webinar series. The Spark theme for January is New Year, Fresh Ideas, Improving Health Systems for Kids. I'm Paula Robeson, your host for the next hour. I'll begin by acknowledging that Children's Healthcare Canada operates on the traditional and unceded territory of the Algonquin Anishinaabe people. We recognize and deeply appreciate their historic connection to Ottawa. Today, Ottawa is home to Indigenous peoples from across Turtle Island. Children's Healthcare Canada is committed to working towards forging new and deepening existing relationships that include First Nations, Inuit, and Métis peoples, and is grateful for the opportunity to share this land as we work to measurably improve children's health outcomes from coast to coast to coast. We're delighted to speak today with Angela Bokenfohr, Laura Rayner, Susan Poitras, and Meredith Trent to bring you Caring for Kids, insights from 3 Canadian hospitals on ChildKind certification. I would like to introduce our speakers for today. Meredith Trent holds a master's degree in social work from Boston College and boasts over 15 years of experience as a project manager specializing in grant-funded projects. She joined ChildKind in 2019 and served as senior manager for the grants division at Inflexion Incorporated. Angela Bokenfohr is a pediatric nurse and educator who's worked in various clinical settings within pediatrics in both acute care and in the community. She's worked as educator roles throughout the health system, as well as various professional programs and national exam boards throughout North America. Laura Rayner is a clinical nurse specialist at the Viredale Pain and Rehab Center at Alberta Children's Hospital in Calgary. With 18 years of clinical experience and leadership experience in areas such as complex pain care, acute pain service, pediatric intensive care, transport team, and inpatient units, Laura possesses a comprehensive understanding of pain prevention, assessment, and management. Susan is a pediatric nurse Susan Poitras is a pediatric nurse and healthcare clinician who has dedicated her career to the welfare of children, youth, and families. She's provided pediatric healthcare for almost 30 years in various roles and patient populations at BC Children's Hospital and is a founding staff member of Canuck Place Children's Hospice. It's now my pleasure to pass the mic to Meredith.
Great. Thank you very, very much for having me. It's wonderful to be here today to introduce you all to ChildKind, tell you a little bit more about what we're all about, and hear from the experiences of institutions that have gone through the ChildKind certification process. So I'm going to start by just giving a little bit of background about ChildKind, and then I will focus on our certification process. So we are a nonprofit organization whose mission is to improve the quality of pediatric pain care in healthcare institutions. We do this by recognizing institutions that have committed to excellence in pediatric pain care. We also work on our mission through educating and advocating about the effects of inadequately treated pain, as well as the benefits of appropriate pediatric pain management. We also foster an open exchange of knowledge. We work a lot with building community and sharing knowledge through the experts that we have, in our organization. So the main core components to ChildKind are our certification process and, like I was mentioning, the knowledge dissemination piece. The certification process is what I will go into more detail about in the following slides. And in terms of our knowledge dissemination, one of the big ways that we do that is we have an open access resource library where any clinician can access the protocols and procedures that we have from our certified institutions that help to share the knowledge about treating pediatric pain. So, what is our ChildKind certification process? What we do is we assess and recognize healthcare facilities that are using standardized, institution-wide, evidence-based approaches to the treatment of children's pain. And once we go through the whole certification process that I'll be talking about, we then certify a hospital as ChildKind certified. So our certification process is built on the five principles of ChildKind that were developed when ChildKind was founded in 2008. So the five principles focus on first the institution-wide commitment to pain prevention and treatment. And this is really the cornerstone of ChildKind because we believe that you need that institution-wide commitment to really then fulfill and widely spread the other components to the ChildKind principles. The second principle really focuses on education and awareness around pediatric pain management. We look at that there are developmentally appropriate pain assessment protocols as well as pain prevention and treatment policies and procedures. And then lastly, the fifth principle, we look at the evidence of ongoing quality improvement initiatives. So not only does an institution put into place the pain policies and protocols and practices, but we like to see that there is then a commitment to make sure that everything that's being put into practice is actually being used, that you might be seeing benefits. If you're seeing challenges, that you then work to improve your processes. So, in terms of applying for certification, we are really open and willing to work with any healthcare institution in terms of certification. To date, we have mostly worked with larger children's hospitals, but we're excited to be receiving inquiries and starting to work with institutions that aren't just the large children's hospitals. We recently certified Canuck Place Children's Hospice, as you will probably learn a little bit more about later in our presentation, and we've received inquiries from smaller community hospitals, labs, and outpatient settings. So we really are open to working with a number of different institutions. With really the thought is that pediatric pain care on the whole is our main focus, no matter the site of care. We do also hope to expand more globally. We have one institution that is certified in Asia, in Singapore, and otherwise, to date, most of our institutions are here in North America. But our goal is to have more global expansion. So, in terms of the certification process, we really kind of break it out into three phases. There is the pre application phase where there's usually an expression of interest in pursuing ChildKind certification. We host, an initial phone call where we provide more information on the certification process and answer any questions that an institution may have. That's also a good initial touch point for us to get a better understanding of where the institution may be at. We have institutions that start at all various levels of preparedness for ChildKind certification when they begin the process. Some institutions are already well poised and have a lot of policies and procedures in place. Some institutions, still are looking to develop a pain committee and to write a pain policy. So we welcome institutions at any, of those stages as they enter the pre-application phase. During that phase, then we provide a structured gap analysis where then the representatives from the organization can kind of take a look at what they already have in place, answer some questions that we've outlined in the gap analysis to really get a sense of what we're looking for and also what they may need to develop to then move on to the application stage, which is the second part of the phase where once we feel like there is enough in place, we invite an institution to apply and they work on an application that really outlines the practices that they have in place, provide a written description of how they're meeting the ChildKind principles, and then also provide sources of evidence to show that the principles are, in practice at your institution. Once our certification committee reviews the application and feels that a site really has, a robust programming in place for pediatric pain prevention and treatment, we then move on to the site visit stage where several of our certification committees actually come to the site and visit and see things in practice. It's really a great opportunity both for the site to show everything that they're doing. And often we find that we're learning too during that process. Some really innovative things can come out of this stage where we see, different approaches that different institutions take to their pediatric pain care. At the end of that, then our certification committee does meet and make a formal decision about certification after the site visit. As I kind of just went into at the site visit stage, our visitors are really looking for that evidence of institutional commitment. Like I said, that's really a big cornerstone of the ChildKind philosophy is that there needs to be commitment and awareness across the board about, an institution's making children's pain care and comfort a priority. We do take a look at and speak with, various representatives from the hospital at the site visit. We learn more about the pain education that takes place, both at onboarding and throughout, annual competencies and things like that. We take a look at some of the policies and procedures that are in place, and we also meet with representatives from the QI department to really learn about the different initiatives that focus on evaluating pain care practices. As we've been growing and learning about the certification process and what it means to hospitals, we did a survey, a number of years ago to really take a look at what are the benefits to ChildKind certification. So some of the key points that we learned and we're excited to share is that I think it really helps to promote collaboration between departments or units within an institution. It really helps organizations to provide more structure to their pain care practices and provide sort of an opportunity to benchmark and take a look at what you're doing and what are some of the goals you can reach in terms of building up the pain care practices at your organization. Some of the benefits after certification that we have learned about is there's just greater recognition of pediatric pain care within the hospital and also recognition in the community that you're an organization that really puts pain care as a priority. Often there will be more support for the overall quality initiatives that are focused on pain management. There may be the opportunity to leverage your institution as a ChildKind certified hospital that focuses on pain management. We also have found that families appreciate the emphasis on pain care at an institution, and this is often seen, through both surveys that are given to families when they are, have had an experience at an institution, and they also may see the presence of the priority of PainCare through, signage and posters that are within an institution. So it's nice to see that not only does the certification um, process help to build the pain care practices at an institution, but there are benefits that institutions experience after the fact. Once a site is certified, there are a few things that we like to, follow up with and to keep in touch with institutions for sure. For one, we are continually trying to build our community of certified institutions. And so I'll talk about this in a couple of slides, but we have a webinar series where we like to continue to connect the network of colleagues who are focusing on pediatric pain management. We like to hear about innovative ideas that are being, done at each of the institutions, and we share that then either through our newsletter or maybe potentially through our webinars. We do ask for submission of resources to our resource library to help to continue to grow that resource for other institutions to learn from the certified institutions. Like I mentioned, we are, building our community of practice through our webinar series. We also have a newsletter that goes out 4 times a year. And these are all ways that we feel like it's important to continue to share information that we have and to also, share exciting, announcements from other organizations that are focusing, in this same area. The webinar series that we have is conducted 3 times a year and is really open to anyone in the pediatric pain community. And we have found that they've been very well received and well attended. And I think that we try to, have the topics focus on areas that would be beneficial to both the certified institutions and institutions that are looking to get certified. As I mentioned, we have our resource library. And again, this is the area that houses the policies and protocols from our certified institutions. To date, the library has mostly focused on resources for clinicians and healthcare practitioners. We have expanded a little bit into resources that are for families and patients, though our primary focus will continue to be more of providing the information for clinicians who are looking to learn more about pediatric pain management. That is all that I have for right now about the ChildKind, certification process and the other programming that we have at ChildKind. I think we're going to take some questions at the end. So for right now, I am going to continue the slideshow, but hand it over to the next group that will be speaking about, the firsthand experience of becoming ChildKind certified.
Hey. Hi, everyone. My name is Laura Rayner. I'm really excited to be here along with my colleagues here, Angela and Susan. And we're going to start off here with introducing ourselves and providing a bit of context in terms of where we are in our ChildKind journeys in terms of certification. So I'll start. I'm from the Alberta Children's Hospital in Calgary, Alberta. We started our certification process in 2017 and finished it in about 2018, which actually feels like a long time ago, but not really. It's kind of one of those weird moments. So we kind of were pre-pandemic certification, have a little bit of a different lens on, like, it's been, a few years now. So my kind of experience and our experience with ChildKind will come from a little different context than Susan and Angela. And I will pass it on to Susan.
So good morning, everybody. So I'm Susan. I'm from BC Children's Hospital, and I'm now the clinical director of pain and palliative care there. We started our ChildKind journey in 2019, at the very beginning of 2019. And of course, we had a big, huge interruption with the pandemic and had to wade through that. But we have been certified now since March of 2023 at Children's Hospital. And we also, in tandem, went through the process, and I coordinated the process of certification at Canuck Children's Hospice. So we had a site visit on the 30th of January and the 31st of January back to back. So that was quite a feat. So that's what we have done in BC.
Perfect. Thank you, Susan. And Laura, my name is Angela Bokenfor. I am a clinical nurse educator at the Stollery Children's Hospital in Edmonton, Alberta. My perspective is a little bit different from that of Laura and Susan. I came on board here September 2023, so just. Our team had been doing some background work and laying some foundation prior to that. But we are still in the process of being certified. So as Meredith had mentioned, we have had our gap analysis meeting, and we are working to try and submit our application by the summer, hoping for a site visit in the fall. So our perspective is a little bit different because we are not fully certified and designated yet.
Thanks, Meredith. So just a quick agenda for today, and we'll just go all through these different elements. We're going to talk about how to get started, like where to even begin, and I think Meredith really spoke to that. So just refer back to her pieces on how to kind of logistically get started. We're going to talk about some key elements on that as well from our perspective, and then implementation, looking at some barriers post-implementation, and sustainability, which will come from all of our different angles. Talk about the health standards organization, and then the overall impact of the ChildKind process from our perspective. Next slide. So I'll just start here and then I'll pass it on to Susan and Angela. So really getting to the start line, it's really it's challenging to know where to begin, and even kind of how to, what's the most kind of important thing to start. I'm going to talk first here about leadership support and Meredith did speak to that kind of being the cornerstone, the institutional support of PainCare at a particular institution. There's lots of different elements here, but we know that that kind of leadership support is really critical in sustaining the PainCare overall and starting the ChildKind process. So kind of at the beginning and in the future, really going in with the lens of understanding that leadership, of course, and institutions have a ton of competing priorities and financial restraints. It is a bit of a challenging system, as we all know at the moment, especially. But however, and kind of creating this awareness and understanding of the impact of pain at the site level and across the site. So we know that pain from an ethical point of view, from a prevention point of view in terms of health and wellness of the children and families is incredibly important. And so it really has, any pain initiative really can have huge impact across the site and individual and families. So creating that awareness with leadership is really critical because, oftentimes we assume that people understand that pain is a priority and how impactful pain and comfort care could be, but we don't always know that. So really creating awareness and education for leaders and leadership and kind of key stakeholders at your institution is really important. Having data to support that, so site-specific data, I found really important. So however that looks at your institution, so different surveys, pulling data from ConnectCare as well, or whatever your healthcare institution is, and presenting that kind of in the language of leadership is really key. And also coming in a bit with a plan of how that's going to be implemented. So through pain committees or whatnot, and kind of chatting with leadership and discussing with leadership about that. We had a bit of a different angle. Our institution in particular already had PainCare in their strategic priorities at the site. So we really looked at that element in the strategic priorities and really expanded that and kind of from the stakeholders and the pain committee and pieces like that. How are we going to support that and move that forward? And how does the ChildKind process fit into that? And what's it going to kind of bring in terms of improving pain and comfort care at the site? So there's that's my experience and our lens from the Alberta Children's Hospital that could be completely different from everybody else's experiences, which is why we're all here. But those are kind of some key elements that I thought were helpful from our lens and Alberta here. So I'm going to pass this on to Angela, I think. Yeah, thank you.
Perfect. Thank you, Laura. I'm going to speak a little bit to funding, which is a question that I'm sure comes up a lot. Everybody is worried about the dollars and cents. Let's be realistic. I am sure the healthcare systems across the country are similar, in which it is strapped for funding. So as a surprise to probably no one, initiating the ChildKind designation process doesn't really come with its own bank account to try and also then support you in that process. So it can be a bit of a barrier, but similar to other sites that have undergone the process prior, I can speak to kind of what our site did. So our site started to lay a bit of the groundwork kind of back to 2019 with some of our key stakeholders and physicians who were keen on pain and pain research. They had sought out grants from people like Wickery and tried to work with getting funding that way to do a lot of that groundwork and research in terms of setting the stage and cultivating the soil for the seeds to then be planted post-pandemic when we were able to actually approach our foundation. So not necessarily like the large institution itself, but the actual, like in our case, the Stollery Foundation to ask for support. What I would say and offer as a bit of wisdom in this is aim high. So when you're seeking out grants or support, try and have an understanding, as we'll talk a little bit later, about what you're going to need for that team and ask for the most. So in our case, I think we'd asked for both a clinical nurse educator and a project manager and a bit of a knowledge broker to try and support that work. Not all of it came through, but it's better to ask for more and then work with what you're able to get. So definitely tap into foundations if you can. I am going to pass it off to Susan.
Thanks, Angela. So I'm just going to talk a little bit about structure and system, and I think both Meredith and Laura touched on the importance of the institutional commitment. And when ChildKind does come to assess a site, it is looking at how the structure supports the care for pain and all the systems that are influencing and having ongoing sustainment for the work. And so our site at Children's Hospital, when we started our project, the structure needed to be built. We did not have a robust structure for PainCare. And so we really started to assess what we needed and be able to build it from the bottom up. And so this is a quality improvement initiative, becoming a ChildKind certified hospital. And so really what we did is we treated it as a quality improvement project. And we developed a project structure to begin with that included many different elements of a steering committee, parent and family advisories, and also several working groups to be able to support the work for the project. But then from there, as we evolved with the project and getting closer to certification, we did work around embedding pain and its accountability within our quality improvement structure and quality assurance structure at the organization. And as well now we're embedding it in the operation structure and really moving that forward at a quick pace. So, even if you're starting from scratch, like we did, that there is hope about building it as long as you have really good supports from your top executives, and then being able to ensure that every level of the organization is engaged. Turning it back to Laura and Meredith, can you please change the slide? No, it's not back to Laura, it's back to me now. So we're going to be talking about now some facilitators around implementation barriers, and there are barriers, and you will discover barriers as you embark on this process. One of the main ones for all of our sites is time that we were discussing, and there's a lot of reasons for that: clinician bandwidth, staff shortages, there's clinical surges. There was a pandemic in our case. So, there's lots of reasons why time is very scarce. And I think people with limited time have challenges to embrace another project or another thing to do. And so, how do you work with that? Because that is a reality in our healthcare system right now. At Children's Hospital, what we did is actually we did some KT planning. We did some knowledge translation planning. And we based a lot of our inquiries and our self-assessment to inform that KT plan. And with the KT plan, also then we looked at the capability, motivation, and opportunities throughout the organization. And we did address time as one of the barriers that we needed to find strategies for. And so for time, some of the key ones that we sort of addressed or tried to find solutions for was to augment existing processes. So piggybacking on processes that are already established, but then adding on pain. So an example for our site was I looked at our patient safety system. And there was no way to track and trend pain. And so what we did is actually added a mandatory pain question when an event happened. And basically it was a basic question of asking, was pain a factor associated with this event? And if people would tick off yes, then there would be sort of a drop down about explaining a little bit more. And from there, we were able to track and trend. And so again, just thinking of ways to add on or augment existing processes was a strategy. And then also we had some roles that were created. We created comfort champions in our organization, tried to recruit and train comfort champions at every different clinical area. And supported them with knowledge and ideas and really trying to provide a community practice to support the facilitation of ChildKind principles and also education across the site. So those were some of the two key interventions that we did to address time. So I'm going to now turn it over to Angela.
Perfect. Thank you very much, Susan. So our site, I'm going to speak a little bit to clinical buy-in. Our site is a bit unique from hospitals that had been certified, at least in Canada, ahead of us, in that we are a children's hospital situated within an adult hospital. So it's kind of a unique situation in the sense of a lot of our clinical teams are dedicated to pediatrics, absolutely. But there's also a lot of clinical teams that are not. So for example, our environmental services or our patient food services or our diagnostic imaging department or lab even, in the span of all of the clinical patients that they will see that day, only a small portion of them are pediatrics. And so for us trying to get clinical buy-in when you're going to those departments was a little bit different. And we just needed to understand that we needed to take a bit of a different approach than going to like our pediatric inpatient unit saying, hey, pain matters. And they're like, yeah, it does. So we took a bit of a step back and we really tried to work with our clinical team to share the ownership right from the get-go. So we shared our ownership of the overall vision, as well as made sure that we involved patient partners, because patient partners have a very loud voice that carries a lot of weight. So if they've had a painful experience in a diagnostic department and that feedback can carry some implementation and some weight to it, it's everybody wants to make a difference. And so hearing from a patient that making a difference is important, that department's like, oh yeah, absolutely. And we're like, yes, it is. So we took the time to try and set up one-to-one meetings with most of our key partners, both to gain trust as well as the understanding of helping them see what their role would be, both in the process and beyond. We gave multiple and catered presentations to various teams, both clinical and non-clinical. So I think we have asked to present at almost all of our grand rounds throughout the hospital, from from anesthesiology to pediatrics to general surgery, and talking to all of our surgeons, as well as meeting up with our environmental services, our food services, all of our rehab staff. In these one-to-ones, we sat down and tried to review kind of what the overall process was, explain a little bit about what ChildKind was, and then seek feedback. So do you, as the group we're talking to, have, gaps in what you see as gaps in pain knowledge or pain application for our pediatric patients? We then really tried to focus on investing in each area that our pediatric patients encountered, and tried to work on building those champions and take those clinical wins from that area. So to meet a lab collector who might only draw peds collections 2 days out of the month, but understanding and taking away the wins that that individual might do when they go into a bedside and they're trying to work with pediatric pain or fear around that. So really trying to get investment right from the very beginning and share that ownership of what our vision would be. I am going to pass it off to Laura to talk a little bit about some resources.
Hey, thanks. Thanks, everyone. I'm going to briefly talk about the resources in terms of having a dedicated person or team involved in the ChildKind process. That was kind of one of the elements when Susan and Angela and I spoke that really helps move pieces forward. So that kind of element is one piece, is just kind of creating someone who is or some people that are in charge of kind of fueling the fire, moving the process forward. That's super helpful from our opinion. Also bringing in some data pieces from a resource perspective. So looking at our site did a hospital child inpatient experience survey. So a site-wide survey, which really moved things forward in terms of we found that our pain was one of the areas that we needed to improve on. So that was a really big win for us in terms of leadership buy-in, clinical buy-in, pieces like that as well. We also did a current state assessment, which there's about 4 of us that went across the site and interviewed, I think, about 80 clinics and lots of people, and developed kind of a current state assessment and gap analysis, kind of separate from the ChildKind one. And what that really did was build relationships with people. So then when the ChildKind certification process moved forward, we were able to kind of go back and discuss with them, and they knew who we are and all that. So that was really helpful. I think the other resource piece is just what Susan touched on in terms of leveraging other areas and resources that all sites have. So one key element was the family-centered care committee at our site. Obviously kind of collaborating with them in terms of the ChildKind process. And the pain committee was also the driving force, which has a variety of stakeholders on that side as well. Our team in particular was fairly small and nimble and a bit creative, and kind of building a team of people that are really keen, enthusiastic, and wanting to kind of move that forward. It's also kind of a really critical element in my mind. I think that's it. I'm going to pass it on to Susan.
So communication, this is a site-wide initiative, and so communication is critical to ensure that people are informed, that they feel part of the process. And so we developed a communication plan actually that addressed both internal and external audiences that included healthcare providers, physicians, staff, patients, and families. And also we developed a lot of communication sort of strategies related to resources to be accessed by the public through online platforms. That we had a network of communications that would be sent out regularly through our internal processes. We had fan-out communications to leadership, as well as we had ongoing sort of education pieces, and as Angela mentioned, places like grand rounds or other division meetings, or having that communication planning to ensure that we keep the momentum going. For us, it took us years to get certified, and we had a lot of work to do. And so things wax and wane. And so it's really important to be very intentional about communication and to ensure that people remain excited as you move through the process. Meredith, can you move? Yeah, thank you. So
Okay.
Sorry?
Go ahead.
Thank you. Are you going to start, Angela? You go ahead.
Sorry, so I was just going to speak a little bit to sustainability planning, only because we have not actually been certified yet. So we are not in the phase of maintaining sustainability yet. But what would be valuable to say in this notion is that we work with our frontline staff to understand that discharge planning starts the moment that the patient is admitted. And this would really be no different in terms of what we've understood. So starting from the very beginning, right from the get-go, when you start the certification process, is trying to look for that sustainability piece. So building up a role or trying to find out who will then take on that work once the actual certification is done, and just trying to keep that sustainability and the momentum up. So whether that is a full-time pain champion, or that is empowering, as Susan had mentioned previously, various pain champions throughout your site, or passing the work on to your pain committee that you've established or have up and running, so that work doesn't get lost. But yes, I'll turn it back over to Susan. Thank you.
So for us, just being newly certified, some of the evaluation and the sustainability pieces that we did start throughout the project early on, and now are sort of really coming to fruition, being able to be accessed, is, we have developed a quality improvement plan for pain for site, which we're working with our data analytics to be able to create a dashboard for regular monitoring and track and trending. As well as our ongoing PSLS reports that we're able to access due to our pain indicator. And also we established a board indicator on their quarterly report related to pain assessment. And so all of those pieces of assessment and evaluation support sustainability, because that makes everyone feel that they need to maintain the accountability and to continue the initiatives that we had started throughout the process. Turn to Laura.
Yeah, I think we can skip to the next slide, Meredith. That's okay. Thanks. Just wanted to mention the Health Standards Organization briefly. This is an excellent resource for hospitals and sites to use and to read through. This was developed through SCIP and the Health Standards Organization, and really looks at quality pediatric pain management of the how-to provide pain care based on the needs, goals, and abilities of patients and families. And that's based on the 4 principles of how to make pain better, make pain understood, visible, and better. And those are the kind of the 4 pillars of the Health Standards Organization. You can download it for free, and really good kind of structure to review for your site. Sit there. Okay.
Perfect. So just speaking a little bit to the impact of ChildKind, I know that Meredith did outline kind of what some overall impacts would be or are post getting certification. And as we go through the process of gearing up for our certification, I would say that the impact is already starting to become quite apparent. So finding out that every single employee, both clinical and non, is striving to actually make a difference in the realm of pediatric pain care is such a huge impact for our patients and our families. And that's what we're hearing directly from them. So environmental services no longer being intimidated by an upset child and wanting to just clean efficiently as they can and get out of the room as fast as they can. Now those individuals are like, hey, is your child in pain? I'm going to go let somebody on the team know so that we can do something about it, is such a huge difference in making that overall difference for our patients and families.
I guess from me, from BC Children's, I think one of the lessons that we learned is that it takes a village, and that the engagement across every level and every unit and every experience that families may have interaction with is so important. as well as the co-development of all the initiatives and education with patient and family voices is so essential to ensure the work is grounded in what matters most to them. And I think the biggest impact for us was that it has been a big catalyst for change, and that it has actually inspired other projects that we're doing on site now related to equity, diversity, and inclusion, and person-centered care. So just really want to thank ChildKind for having such a great model for us to be able to lean into.
Yeah, I can quickly echo all the points that Susan and Angela made there. It's been a huge impact for us as well at the Alberta Children's Hospital. I think, from us being a little bit further out, just of note, it's, that kind of having that mindset of adaptability and kind of flexibility in terms of ongoing sustainability, working with the larger system, whatever comes at us these days, and really creating kind of partnerships, relationships with all stakeholders is really essential to success in changing the culture of your site within PainCare and comfort.
Thank you so much for what has been a great presentation. So I'll just get started on the questions. I'm just going, none are directed specifically to any one of you panelists, so feel free to jump in as you need to. Talia has noted that our site is outpatient based and includes audiology, prosthetics, child and youth mental health, developmental pediatrics and rehab, and autism care. So not typically engaged in more traditional medical procedures, but how do you see some of the principles being applied to that site or others for that matter? And do you have folks who've been certified who are in similar situations where they're not necessarily looking for, it's a different, slightly different sort of setting? I imagine the principles apply, but I'd love to hear from you.
Great. Sure, I can speak to that. So that is an area where we are starting to grow, and we are working more closely with a couple of rehabilitation facilities right now. And so that's maybe is a little more akin to your organization. And we're really kind of thinking creatively about how to apply the principles to different types of institutions. I think that on the whole, we do see that all the principles can still apply. Again, that commitment to, comfort and pain care for children, and the education for all of the staff around, why that's important and how to apply, different principles in terms of pain care. And just really the focus, again, like I already said, on comfort. But we recognize that it is going to look different in different institutions, and, how often education may be able to take place, or how you may be able to implement quality initiatives if you have, different groups that you're working with or a different patient population. So we do see that the principles will apply, but we definitely look to thinking creatively about what an application might look like and what the site visit might look like, and different things that we're asking for.
Perfect. Thank you.
I can just add, because our site does have Sunny Hill Center for Rehabilitation on our site and was included with our recertification, and just a really couple, if there was a mobility clinic, would be providing assessment before they move children. Speech and pathology, talking about how to communicate with children around pain that have differences in communication. And then also the Botox injections using EMLA that they didn't use before. So these are all really simple things, but our rehab center was amazing and really embraced the principles and trying to find ways to implement it.
Oh, brilliant. The next question comes from Corey. Does ChildKind help teams to build their proposals to gain senior leadership buy-in? And there's a two-part, but let's start with that one for now.
Sure. So To date, our model has been, an institution may come to us and express their interest in ChildKind certification. We, explain what we're looking for, what the process looks like, things like that, the things that we, want to see an institution have in place. And then we kind of let them go and approach it, as best they can, because each institution is so unique. Also, we are a very small organization with, a core group of experts on our certification committee, but they do also have their full-time job. So they're not necessarily paid to come and guide an institution through the certification process. What we have learned over the years is that we want to be able to provide as much guidance, some samples, things like that to an institution that's looking to become certified, but that's an area where we are still growing. So there isn't like necessarily a constant hands-on guidance that we can provide to an institution. And it's two-parted. It's partly our model and also partly the fact that institutions are all unique.
Well,
I
yeah,
don't know if that
that makes
answers
sense.
the question well.
Absolutely. Do you know of other organizations who are in process or have already been certified that maybe have developed like a business case that might be presented to senior management, just as an example of something that folks could adapt to their own purposes?
So I don't know if any of the three of you actually developed a business case. I don't know of a specific business case that an institution developed. What we have is some language around sort of the value proposition around ChildKind, and there are different, paragraphs and pieces of information that we can provide to an institution that may help to build the case of why ChildKind is so important to work towards. We do have a benefits to certification page on our website, but we can also help to, to build that up working one-on-one with an institution, but we don't have a specific written business case for institutions to use.
Perfect. If anybody wants to take that on or share, over to you. How do you work with sites to help them prepare their programs? Is there implementation support or guidance? Is it more resource sharing and other supports that are offered either through ChildKind as an organization or certified organizations who might do this voluntarily?
Laura can maybe speak to the fact that we have reached out to her a couple of times in terms of, we have an institution that is similar to Alberta Children's. Might you be able to, show them samples from your application or tell them how you developed your pain committee? So, again, we don't provide a lot of hands-on guidance or, we don't have someone who's right there with an institution helping them develop their programming. What we do hope to do is we have each institution, once they enter the certification process, they are assigned a certification committee sort of lead from our organization. And so that person is available to the institution to answer questions, to provide the guidance. Often that's done over email. Sometimes we set up, regular check-ins or phone calls to more specifically answer questions. But we definitely do also rely on and reach out to our already certified institutions who can really provide some of that on the ground information about how they maybe developed, a specific protocol or got, buy-in from their leadership or, communicated with their various units about how to spread the word and the importance of ChildKind.
And a few of you have mentioned knowledge mobilization support, and I'm assuming that that part of that skill set also involves implementation support, but it may or may not. But that might be how some folks are accessing that level of expertise and support. Angela has asked, is there a knowledge translation plan framework available related to ChildKind implementation?
Maybe not. Or go ahead, Susan. Yeah.
Well, I was just going to say that there are hundreds of knowledge translation models to choose from. We did develop a knowledge translation plan based on the 5 principles. So basically the model is the 5 principles.
Mm-hmm.
And how is your specific organization going to address them? And it's going to be unique depending on your organization and also what you currently have and what you currently need to close the gap on. Yeah, like we used the COM-B, and that was what we used. But there's many different knowledge translation courses and implementation courses, and I think somebody on the team that has that knowledge would be extremely helpful.
Wonderful. Megan asks, is it possible to have a copy of the CAP, I think it might be gap analysis tool, as part of the pre-application process? She'd love to bring it to a team meeting that they have coming up.
Absolutely. Yes, I can share it with you, Paula, to share it with everyone, or we don't actually have that on our website to date, although it's something that I may look to add to actually just have open access for anyone to take a look at it, from our website. But I am happy to send it to whoever. One of the reasons I think we don't have it out there right now is it's always nice for us to kind of know who's thinking about this and to have that initial contact so that we can then, send the gap analysis to someone specifically, but I'm happy to share it.
Wonderful. We have a section on our website related to the webinars where resources that are shared during the webinars can be posted or linked. So we can always share it there, and you can check back, but I'm happy to share it to this audience as well.
Great.
Megan also asks, are the ongoing requirements or expectations for maintaining ChildKind certification after the criteria is initially met? So maintaining certification, is it a one and done, or is there checks and balances?
That's the question of the day. No, we are in the process of thinking about and developing a recertification plan with a couple of things in mind. One, we see the importance in that because of the sustainability piece, and we want to know that institutions that are calling themselves ChildKind certified are maintaining the practices that they put into place. However, we recognize that achieving that initial certification is a very big undertaking. So we are looking at ways to reevaluate a site that is already certified without making it, a really big task. So it's not yet defined or fully rolled out. So right now there is not an obligation for a recertification, but we're thinking about what that process might look like.
Wonderful.
Yeah, I'll also add there quickly is that, and this, correct me if this has changed, Meredith, but they do offer a recommendations page after a certification is complete in terms of kind of areas of growth and where you need to focus on. So that's a document that we've taken and kind of moved forward with. And it's been a really great kind of instigator for change in the areas where we needed some kind of, areas of improvement. So that's a nice piece, like a document to take forward and kind of has created some sustainability from that as well.
Oh, wonderful. Evaluation guide. This is from an anonymous participant. Evaluation guidance. Typically built into the plan from the start. Are there templates that you've had around what metrics you use or KPIs or what data you collect and share?
I don't know if anyone else might want to speak to that. We don't have a specific outline of what we're looking for with evaluation or QI. Institutions, again, it can be so unique to a specific institution. We have some markers that we might specifically want to see, but it's really unique to an institution. So I don't know if anyone else has any comments on that.
Yeah, we worked with our QI experts and project office to kind of amalgamate the ChildKind principles with kind of a QI piece. So I don't think there's one specific one because there's just a lot of elements that you can look at. But I think overall kind of encapsulating some broad QI pieces and then whatever is kind of important or whatever pain initiatives at your hospital, you could kind of capture that if that makes sense. But working with different models and QI people, that might be help to really create something that works for your site.
And as a final question, Annie, I'm just going to unmute you, Annie, and go ahead. Oh, you might need to unmute yourself. Can't hear you, Annie, if you're chatting. No, we've lost Annie. So that's the end of our time together today. I want to thank you all for your attention to this. I want to thank you all your speakers, for sharing your time and expertise. There are a number of comments in the chat box about how this has been very helpful. And your responses to the questions, I'm sure, will move people forward. There's a few folks who are exploring the idea of certification. So for those early adopters on the panel, perhaps you'll be called upon for some questions and support as well. In addition, the Health Standards Organization, together with Solutions for Kids in Pain, developed a pediatric pain management standard that certification through ChildKind will help achieve those standardized the standard elements as well. So I encourage you to take a peek at that. Laura, did you have a comment?
No, just waving at Lori in the chat.
Okay, wave away. But that, again, that's the end of our time together. Thanks, Angela, Laura, Susan, and Meredith for sharing your time and expertise, and to our audience members for joining in. We know how busy everyone is, so are delighted when people take their time out of their day to spend with us. We've got a packed schedule coming up at Children's Healthcare Canada. Still in January, we've got a Spark Conversations podcast coming up. Will be released on January 29th. It's Creating Equitable and Inclusive Health Systems for Children and Families with Dr. Catherine Smart in conversation with our special guests, Dr. Nell Wyman and Dr. J.C. Cowden. This was recorded live at our recent conference in Vancouver in December. In February, we tune in for Spark Live. We have a webinar called Let's Talk Disability and Sex, the power of co-creation and knowledge mobilization to meet the needs of preteens with disabilities. And we're offering that in collaboration with ChildBright. And in March, we're inviting you to join us for a 3-part child health equity, a system-focused learning series. And the series includes the following sessions: delivery of equity in all child health services on March 7th, inclusive child health research for equitable outcomes on March 21st, and evidence-informed policy advancing health equity for all children on the 28th. And there are a couple of NOOFs on the line, and I want you to save, all of you to save the date for our Children's Healthcare Canada 2024 conference in the beautiful and wonderful St. John's, Newfoundland. Happens to be my hometown. And it's being co-hosted with the Janeway Hospital Foundation. It's great if you can watch live as your questions and comments enrich the discussion. But if you can't, the recordings of these sessions are made available after the fact on our website, childhealthcan.ca. Thanks again for joining us. And thanks to our wonderful speakers for this presentation. And hopefully we'll see many of you back here soon. Bye for now.